I'm Ranga, base hospital, sorry, I just so I'm talking about wound care. I think I can't cover all of these things. All of us has an experience of wound care, and when we are talking about wound care, there are two types. It's physical, other thing is psychological. So I'm talking about physical. So before I engage into the wound care, so we have to understand the type of wound, right? So there are two types of the problem and the misleading things. So one is wound, other thing is ulcer. So some majority of us straight away are telling wounds for the ulcers, and it is actually some kind of a contradictory thing. So however, so I think all the surgeons know what is the difference between wounds and ulcers. So wound is it's a discontinuation of the integrity of epithelium due to external causes, and ulcers are due to the internal causes, right? So you will see ulcers in the internally. So the example is a venous ulcer. You can see these things. So when we are treating a wound, so it's like carrying a kit, right? So if you care to nicely, it will nicely grow. Similarly, so wound ulcer also we have to treat like a mother, right? So I think I always put this slide because wound is like a paddy land or something, like a chain land or something, right? So if the wound is growing small plants, right, over some kind of the paddy. So for that we need a water, and that is water like a blood, right? So attribute to the body, it's a blood. And fertilizer is nutrition, right? So all the nutrition what we are giving. So other thing is pesticides. So if there's a wound, so we have to give an antibiotic. So antibiotic goes some and the antibacterial external agents. So that like a pesticide. So then the other thing is cleaning and debridement. So what we do when there's paddy land, so you go and spray the pesticides or weedicides, and sometimes we remove the things and like that. So same scenario, we need the wound, right? So here when we are applying a debridement, so and also we have to understand the etiology assay. So everything is there. So I don't think anymore I have to explain about the wound. So anyway, we will talk. So when we come again, so same side. So this methodically and scientifically I explain again. So wound assessment is needed. So wound cleaning is needed, and timely dressings, change, and all these things are needed. And also appropriate dressing we have to select, right? So the modern technology, earlier we always apply some betadine or surgical spirit or hydrogen peroxide or other things, and then we apply betadine again. So, but nowadays there are several new equipment has come, so we have to apply those. So these are the main causes for the wound. We all know trauma, infection, neuropathic deformities, and then we have to select the dressings. So before selecting dressings, we have to adhere to certain principles. We have to adhere to aseptic principles, and always wear gloves, cleaning the hands, and clean the wound environment and all the. So then these are the principles of selecting wound dressing again. So I said that. So we have to have an idea about the wound, and we have to have what type of wound is there, and then what kind of pH is there, whether there is a bacteria, whether there is a ongoing sepsis is there, whether this patient is diabetic, and also whether this patient having a uremic patient, like kind of the CKD patients, and then we have to go for what kind of absorbent dressings, what kind of gauze, what kind of the hydrogels, and those things we have to think about, right? So this is simply, actually I took this picture when I was the registrar. It is in the wall of the Prof unit Ranga. So this picture I took. So this is So when we are selecting again dressing, so I am not telling about the commercial products. So but so dark thing are it is I mean with the scabs, right? So that means we have to remove the scabs. So in this kind of things, there are less absorbent dressings are needed, but we have to do the left diamond and then this several right. So, right. Okay, if not healing, so there are several things you have to think. So whether the pulse absence, whether the underlying osteomyelitis, diabetes, and then the venous, the varicose veins, and other all the systemic diseases are in the middle, right? So you have to think about this thing, and also blood supply, right? Right. Do you have any questions about this one? I think you all have questions. So this is a very big topic. I can't summarize it in a couple of minutes. So, do you have any questions?
Yeah. In the interns, my concern surgery used to use pepper dressing for is it still performed?
Of course, yes, it's excellent dressing. So it's neat. So I used it. So I have when I was working in the locality, so I started. So it's an excellent dressing, and I still believe because it has a proteolytic enzymes. It nicely cleans the wound. But when you are when you are applying pepper dressings, so you have to select what kind of wound you have. So a lot of in my early slides, so where it's like a kind of this area, yellowish discharge area. So if you apply pepper dressings, that is good. Thank you very much.
So I like how you try to conceptualize the wound. Can you go to that slide? The pediphilia one. What do you think about that? Yeah, it's a nice way. This is what we call in education. This is what we call an advanced organizer. In the lecture, have you heard about that word? No. Yeah. What is meant by that is you try to conceptualize. This is all about conceptualizing. Ultimately, most of these things is about conceptualizing. So there are certain difficult concepts that you can simplify in some other different way. For example, say the heart anatomy. But when you say heart as a pump, you have conceptualized in a simple way. Similarly, even the lungs. Like that, there are ways to conceptualize difficult concepts. And you have to do that at the beginning of the lecture. That is why you call it advanced organizer. When you give the advanced organizer, you are preparing the audience for your concept. So you give it straight away. So this should come at the very beginning. And you have to, so I would like to conceptualize the wound in this way. However, having said that, what is the wound here?
The wound is the paddy land.
Paddy land. But isn't it the skin? What I'm asking is, if you conceptualize wound as the paddy land, you are creating some kind of discrepancy, because paddy land is something good, no? Yeah. Something healthy. But if you say abandoned paddy land, that would be better, isn't that? So that would appropriate. Then you can put all these things together. But this very important thing, having an advanced organizer at the beginning of the lecture. Okay, yeah. Objectives I can see in your slides. Yeah, and can you go to another? Yeah, the next slide or any other slide? Okay. What about the clarity? Is it clear? No. Why? Color contrast is not good because the light yellow, light blue. There is no contrast. And also there is a gradient. Better to avoid gradient slide. Use a simple slide background. This, what is there in the outside also, unless you are talking about something like fungal infection, it won't make a meaning. And the gradient makes it even more difficult, because when there is a gradient, then whatever font you use, it will be ineffective. If you use dark font, that will be not effective on the dark side. If you use light mode, that will not show up in the lighter side. So better to have this gradient, right, which is there in the PowerPoint. Yeah. Yes. I think the last slide what you have put is a waterfall. It doesn't give any meaning. But if you have put a very nice paddy field, might have linked with your because it should give a result. Yeah. So yes, thank you slide. Yeah. So those are some areas for improvement. I think better to work on your confidence. If you work on your confidence and with more practice, I think your body language will fall into place. At the moment, it was apparent that you were somewhat lacking the confidence. You had the knowledge, but the confidence part was not there. That's why sometimes you were trying to lean onto the table or keep your hand in the pocket, because that part you need a little bit more training. Okay. So when you increase your confidence and the practice, I think you would do it. Any other feedback? Could have been more impact. That also comes with confidence partly. When you are more confident, then you are more confident about interacting and engaging. So those are, with practice, they should come.